socio-economic conditions, climate change and pests have been a reality for vulnerable communities for years. This has been compounded by COVID-19, which has reduced incomes and interrupted food supply chains. Let's find out what that situation is like in the country from Operation Hunger Interim CEO Sandy Bukula. Sandy, good to have you back with us. I mean, the issue around food insecurity impacted by COVID-19 has been a hot topic throughout the year, and I understand it's not getting any better.
It's not getting better at all. I mean, good nutrition is an essential defensive strategy to protect population against epidemics. And this usually releases, the burden on our health systems while delivering universal health coverage and ultimately saving lives. So what we've seen during the COVID-19 has been an increase of people actually either without at all food or without proper nutrition. And this has increased the burden on basically, food aid organizations such as ourselves.
Yeah, but you also say that South Africa needs to come to a point where they relook, their national nutritional status while at the same time securing, food systems. How do you suggest this is done?
Basically addressing dietary and nutrition inequities is about improving the distribution of opportunities to live a healthy and a fulfilling life. And government and other food system actors generally favor interventions focused on individual level. While direct action can help, it is important also to consider the underlying unequal distribution of factors that support the opportunity to eat, healthy diets that are necessarily available and accessible to everyone.
Yeah.
So basically just having a generic strategy that is basically plainly, because over the past 9 months we've seen basically the introduction of basic food aid provided by government in a form of basically stipends, I think increasing some of the grants and SASA grants, but it only has been looking at the one population and actually not looking at everybody else because, the COVID-19 has taught us basically that we have our missing middle in the country, those people that basically before the COVID-19 had, the ways of generating income by themselves, but because of the COVID-19 and the constraints, of the lockdown, they haven't been able to participate in the formal economy or even in the informal economy and put food on their tables. And those people don't actually qualify, first of all, for food aid, for any type of aid. You know what I mean? So that leaves a burden for those people to say, where do we actually go and how do we put food on the table?
Yeah.
And we're not, our inequities aren't as easy in the country because, food security in the country is basically measured by, having access to income. You know what I mean? Instead of actually having all the other factors of food environments that assist the family to put food on their table. Like having distributed land, to start your own subsistence farming. All of those things actually impact us in being able to be self-sustainable. We're having to depend, on food aid. So all of those things actually have impacted in the increase. Disproportionately across, like your rural and poor, your rural and poor, your lower income
right.
households. Yes, those people that used to be, in the informal economy as well, that were able to put food on their table without actually needing help.
Yeah.
And I heard you this morning talking just about the tourism. So think about those people, those informal traders, that actually were looking at, increasing their strategy to create more, to generate more income.
Absolutely. And Sandy, when we talk about, the most vulnerable, we also look at children. Another high, very much spoken about topic this year at least was about those young, vulnerable children from those disadvantaged backgrounds who depended on food while at school. And now that there was a hard lockdown, they were stuck at home, they wouldn't get that nutritious meal that they obviously relied on while they were at school. When you talk about transformation of food systems here, obviously that would benefit such groups. This has to be top priority for government as well as other interest groups.
That's correct. It has to be a complete, what we've seen with ourselves, because, we look after 2.4 million beneficiaries and they are in different, they are in different phases of the program. But what the COVID-19 brought to us was about at least 10 to 20,000 new families, of children sometimes that had to that were getting food from the ECDs from schools,
right.
From churches and all of that, just coming in and flooding in. So it has been quite a tumultuous to say, like the amount of increase in the need over such a short period of time. And this obviously has highlighted basically the reverses of the gains that we've made within malnutrition. I mean, just this year, in June, the Global Nutrition Report came back saying that South Africa will only reach about 2 out of 10 of the nutrition targets for 2025. And that should be really scary, because that means even that 2 out of 10 is going to be reversed now. And you're already having issues, with basically anemia, low birth weight, exclusive breastfeeding, childhood stunting, childhood wasting, and then childhood overweight and adult obesity and adult diabetes in the country. So if you think about that, having not addressed this issue now and having the reversal of the COVID-19, it's basically going to be a burden again onto the universal health coverage completely. And that's we're anticipating the increase to be at least about 30.8% at the moment.
Those figures are quite staggering there, but thanks for putting them on the spotlight. Thank you so much for talking to us.